My name is Sanjay Gupta. I'm a cardiologist in York. Today's video is on the subject of medical gaslighting. This video is entitled Medical Gaslighting, What It Is and Why It Hurts. So have you ever left a doctor's office feeling worse? Not because of your symptoms, but because you felt dismissed, ignored, or told it was just anxiety or just in your head. Today we're talking about medical gaslighting, a term that's becoming more common and unfortunately more relevant. What is medical gaslighting? It is when a healthcare professional minimizes or dismisses a patient's symptoms. It often involves phrases like, "It's all in your head, your tests are normal, there's nothing wrong, you're overthinking this." And patients unfortunately begin to doubt their own experience of illness. Who does it affect most? Well, women, especially with conditions like POTS, postural orthostatic tachycardia syndrome, ME/CFS, endometriosis, people who have invisible illnesses or symptoms that don't fit textbook patterns. It affects patients with mental health histories or complex chronic conditions. It even affects those who question or challenge medical authority. Why does it happen? Well, there is a degree of time pressure in modern medicine, so doctors just don't feel they have the time to listen to patients and try and understand what the patient is telling them. There is a cognitive bias. If the symptoms don't fit, then it is easier to blame the patient. There is definitely a lack of training in complex multi-system disorders like dysautonomia or mast cell issues. And there is still the persistence of the doctor knows best culture. But medical gaslighting has a very harmful impact on patients. It can lead to delayed diagnoses, sometimes by years. So if you talk to patients with POTS, the average time from the development of symptoms to getting a diagnosis can be up to 7 years. And unfortunately, it can lead to worsening symptoms, increased anxiety, and a loss of trust in healthcare, to the extent that many patients stop seeking help entirely. And we as healthcare professionals can and should do better. As doctors, we must validate experiences even when we don't fully understand them. "I don't have an answer yet" is better than "it's nothing." And listening, curiosity, and humility should be part of every consultation. I've heard too many stories from patients who were told for years that their symptoms were psychological, only to later be diagnosed with real, measurable conditions. It is a failure of empathy and open-mindedness, and we need to change it. If you've ever experienced medical gaslighting or have been afraid to speak up about your symptoms, please do share your story in the comments. If you believe in patient-centered care, please keep this conversation going. There's more we need to talk about. All the best.